You guys read reviews on Google, or probably I often get the relatives telling me that Dr. Saab, you did a good job. Now, actually, it's not just me, in cardiac surgery, it's never an I, it's always a we. So, how big is the cardiac surgery team? So, I'll just quickly take you through how big our team is. So, in a cardiac surgery team, there is primarily a cardiac surgeon. Then, inside the OT, we have an assisting surgeon who helps us during the procedure. We have two perfusionists. Now, these perfusionists are very important guys. They run the heart lung machine. The heart lung machine is a machine which takes the work of your heart and lung during surgery. And then again, when we switch on the heart, all the blood from the machine is transferred back to the heart. So this important job is done by our perfusionist. They also run a machine called the cell saver. Now what does this machine do? So the blood which is lost during surgery is filtered and again put back into the patient's system by this machine so that there is barely any blood loss. This is again done by our perfusionist. Then we have a cardiac anesthesiologist and one of his juniors who would be there during surgery. We will have a very important OT technician, a couple of them, who help us through the dynamics during the OT, the monitors, the settings, the lines, the connections, all of that is done by them. Then the most important people on my right side are the cardiac scrub nurses. Again, a couple of them who help us during the procedure. Along with this, we have a guy who keeps running with all the blood investigations to get the arterial blood gas report, to get the blood. These runners also help us, the housekeeping. When the patient goes into the ICU, we have a cardiac intensivist. Then we have an echocardiographer who comes and routinely does a 2D echoes on the bedside and tells us about how the heart is functioning. We have trained cardiac surgery nurses in the ICU. Most important part of ICU care is also having properly trained cardiac physiotherapists. Yes, these are the guys who start making you walk, run, talk after surgery. So we need them as well. Once the patient goes back to the ward, again, the nurses, the housekeeping and the physiotherapist along with our team. So you see, cardiac surgery has a lot of people involved in it. And that's why all of them are equally important to make this a very successful program.